February is Heart Month. It's an opportunity to highlight the connection between heart disease, cardiac risk, and diabetes, and also the impact it will have on Canadians living with diabetes. Joining me this AM to take us through 5 questions you can ask yourself today is Dr. Mansoor Hussain, the director of the Toronto General Hospital Research Institute. Doctor, thanks very much for joining us this morning. We appreciate you coming in. We were talking about this off air. I was quite surprised the connection concerns with the lungs, lung health and diabetes and how they tie in together. Explain a little bit about that before we get to the questions.
So, diabetes really is a risk factor for cardiovascular disease, and once you have cardiovascular disease, it can also affect the lungs. So here in this first segment here, what I've brought is some pictures, Rogers, to look at. What you'll see on the left-hand side is a normal chest X-ray. You see the heart in the middle isn't shaped like a Valentine's heart. It's a more globular shape, but that's a normal-sized heart, a normal-shaped heart. And around that are clear, healthy lungs, the dark areas around it. And on the right-hand side, what you'll see is a patient with heart failure. This individual with diabetes is at increased risk of heart disease, including heart failure. And here you'll see the heart is so much more enlarged. The shape of the heart has changed. And now the lungs are congested with fluid. We call this heart failure.
And that is that combination, and it's a growing concern here in Canada.
Right.
Let's talk a little bit. Let's get to the questions now. Right. I have not seen any of these, so I'll be answering honestly.
Roger, I'm here to
Monday morning quiz. I'm not ready for this, but let's give it a try. For Heart Month.
In the interest of Heart Month, thank you for featuring this segment. Some really important questions. So first question, Roger. Diabetes affects how many Canadians? And it's multiple choice, so it's going to make it easier for you. A, 100,000. B, 2.5 million, or C, over 10 million Canadians?
I want to say 2.5 million.
So it's a little bit of a trick question, because if I'd asked you diabetes, how many people in Canada live with the diagnosis of diabetes, your answer would be right. But in actual fact, the correct question is, because I asked diabetes affects how many Canadians, is actually over 10 million.
It's over 10 million. 1 in 3 Canadians.
1 in 3 Canadians. About 11 million people either themselves have diabetes or have a condition called prediabetes. And if you ask Canadians how many of them have a family member affected with diabetes, it's actually over half.
So everybody knows somebody, essentially.
Everybody knows somebody who has diabetes.
Unbelievable numbers, but those can be changed too. Let's get to the next question.
All right, so next question. This is a true or false question. So again, you got a 50-50 chance.
All right, I like that. I like my odds.
People living with diabetes run a higher risk of cardiovascular disease. True or false?
True.
Absolutely right, Roger. So Canadians living with diabetes have a 3-fold higher risk of heart disease than an individual without diabetes. And that's all forms of heart disease. In fact, the image I showed earlier about heart failure, the risk is about 4-fold. The risk of kidney disease is almost 10-fold. So it's a very significant risk factor for a number of conditions, including cardiovascular disease.
Okay, very sobering numbers. What's question 3?
All right, question 3. Diabetes and heart disease share similar risk factors. True or false?
I'm going to go with true again.
Again, you're spot on. So diabetes is a condition that's associated often with either being overweight, having an unhealthy lifestyle in terms of eating habits. And when it does occur, it actually increases the risk of other important risk factors like blood pressure can be elevated. As I mentioned, your fitness level can be reduced. And so your cholesterol levels can also be elevated. So it's that toxic combination of the risk factors that really multiplies the risk
and becomes a bit of a vicious circle because it's harder to do the things you need to get healthy.
Exactly.
Okay.
And when you have all those risk factors together, you get hardening of the arteries, which leads to cardiovascular disease.
All right, question 4.
All right, question 4. Again, true or false?
I like the true or false.
Yeah. Men with diabetes are more at risk of having a heart attack than women.
I would have said a few decades ago, yes, but I'm going to say no. It's almost, is it equal now?
So you're absolutely right. And again, I made it a little bit of a trick question for you. If I looked at the general population, men do have more cardiovascular disease than women. But curiously, for reasons we don't fully understand, not in diabetes. So in the general population, being of the female sex, you're protected from cardiovascular disease for about a decade. But for some reason, diabetes, because it accelerates cardiovascular disease, actually more women with diabetes have cardiovascular disease than men.
Okay.
So the correct answer was false.
All right. And last question.
And the last question, you're doing great, by the way. there's nothing you can do if you have diabetes to limit your risk of heart disease.
That is definitely false.
Absolutely right.
There's so many things you can do.
Absolutely. So effectively managing your diabetes, and we call this the ABCDEs of the management.
Yeah.
So the A is in reference to the A1C, which is the blood sugar level. So managing your diabetes to try and get your A1C level to target is important. Blood pressure, you know, we're going to check
That's
your
what
blood
we're gonna
pressure
check.
now.
I'm getting ready
That's
as
the
we
B.
talk.
C is cholesterol. D is for drugs, making sure you're on the right medications to talk to your healthcare provider. And then E is healthy eating and exercise. And then the 3 S's, which is the self-management, the screening, making sure you don't have complications. And then, of course, stop smoking. Smoking is not good.
All things you can do. And blood pressure is an important indicator, is it not?
You better believe it. You
All
ready
right.
to have your blood pressure checked?
I think I am.
All right.
Let's see
After
how
that
we do.
quiz, you know. All right. So I brought
And
one.
when we're looking at blood pressure, what is that showing if it's up? What are the concerns? What are the indicators that?
So blood pressure is, is the workload that your heart is doing. If your blood pressure is up, your heart's working harder than it needs to be, and it would increase that hardening of the arteries, also increase the risk of heart failure, increase the risk of stroke. So blood pressure is a really important risk factor, and it's often silent. There are no symptoms necessarily of modestly high blood pressure. So really important. This takes about 30 seconds.
And if you don't get into your doctor, there are places you can have it, and they're fairly accurate. They're just a good indicator. You should always go see your doctor, of course, about it.
They are. In my office, I might use my stethoscope and a blood pressure monitor, but now we're moving more to automated blood pressure monitors. You go to your pharmacy, you see they'll often have one there, and they're quite accurate.
And it gives you an idea, and if you start seeing it to increase, you should be going to see your doctor for sure, right?
Absolutely. Absolutely. So,
oh my goodness. How? We're
quiz.
showing it on the camera. Holy cow! Because we took my blood
We did.
earlier, and I was
You were bang on
130.
normal.
Yeah, it was bang on normal.
Right.
So why would the spike be?
so many factors.
Am I guilty?
If I was wearing a white coat,
Yep.
we'd call that white coat hypertension, right? High blood pressure. But I'm not. But you just went through a grueling quiz.
Would that actually spike it though?
Absolutely.
In all seriousness.
Absolutely.
So
it's the body's stress response.
interesting.
Yeah.
So
I'm gonna have to come back and measure your blood pressure again.
let's
without
do
a
it
quiz.
let's do it in like 20 minutes.
Yeah.
That is absolutely, well, it's kind of frightening actually.
Yeah.
That's a 20-point jump. All right, doctor, thank you very much for joining us
Thank
today.
you for
We
having this
appreciate
segment.
it. Very interesting. All right, if you or someone you know is living with diabetes or pre-diabetes, visit Diabetes Canada, diabetes.ca, or Heart and Stroke, which is heartandstroke.ca, for more information. We have more on BT coming up after the break. I think I'm booking an appointment with you.
Anytime.
That's a spike.